Hi, my name's Dr. Catherine Chan, and today I'm going to show you how to administer chemotherapy using PhaSeal. So in this video, you can already see that the IV cannula has already been placed. You will also notice there's a disposable pad underneath the patient's leg in case there is a chemotherapy spill during administration. When I administer chemotherapy, I tend to use the saphenous veins in dogs, and for cats and small dogs, you can use a cephalic vein, but I tend to use the saphenous vein wherever possible to allow preservation of the cephalic veins for when an emergency occurs or if the patient needs to be hospitalized for intravenous fluid therapy. Sometimes patients receive multiple chemotherapy injections and their veins over time can become damaged. Hence why I try to use the saphenous veins wherever possible. You will notice that the IV catheter is taped in a way that's very different to patients when they're in hospital. If you look closely in the video, you can see that the saphenous vein is on an angle, which is directly parallel to the vein, and the way it's taped is directly perpendicular across. Over time, you will develop a technique on how you tape catheters in place, but this is just generally how I tape them in place. You will also notice that the catheter is taped in a way to allow direct visualization of the vein. This is important, so you know that you're going directly into the vein and there's no evidence of subcutaneous administration. All cytotoxic injections should be labelled accordingly, and the saline is clearly labelled so you know when you're administering chemotherapy and when you're administering saline. So this operator is giving vincristine, and vincristine is given as a IV bolus, so it can be relatively quick. This operator is administering it slower than usual, but that is okay, you can do that as well. When removing the PhaSeal from the system, you will notice that the operator has hands only on the white portions of the PhaSeal system. When removing the PhaSeal system, you'll know it's a pull action and a twist, and it's the opposite action when you insert. So the operator now has saline, and as the operator is going in, it is a twist and then push action, and the saline is flushed nice and slowly. This operator is actually giving 2 chemotherapy drugs through the same vein. So the next drug administered is cyclophosphamide, and it is also a clear solution, and this is given as a slow IV push, so slower than you would give vincristine. So once the cyclophosphamide has been put through, when removing the PhaSeal system, you will notice it is a pull and then twist action. So it's the opposite of what we discussed earlier. And then again, when inserting with saline, it is going in as a twist and push. It is really important that when you do switch between drugs, and after administering the chemotherapy drug, that you administer saline as a push. Do not draw back on the saline at this point of time. And this is extremely important. Otherwise, you will have chemotherapy in the syringe and you will need to use another saline flush to flush. Once the chemotherapy has been flushed through adequately with saline, we clamp off the end. We remove the PhaSeal with a pull twist action. Now the top of the catheter tape is removed slowly across the top. You don't need to remove the whole tape. You can if you wish, but I prefer not to. I generally just leave it there, and as long as it's off the cannula itself. Then we put a swab on top, and you gently ask your holder with gloves to hold the swab over the catheter. And with numerous swabs, you place it over the catheter system and pull it off to remove the whole system. I think it's important to put the chemotherapy catheter directly into the chemotherapy bin. And then using a pressure bandage, you can now place it over the pressure bandage, and then we are done.